Assalamu alaikum. In this discussion, I will discuss about febrile fits, which are very common in pediatrics age group. Febrile fits are associated with fever in absence of detectable CNS infection. There should not be CNS infection, and the patient will have seizures. Then you may suspect febrile fits in the patient. These are generalized tonic-clonic seizures with loss of consciousness in otherwise healthy child. Most common cause of a childhood convulsions. So these are the most common cause of childhood convulsions. These are more than 90%. These are generalized. These are of less than 5-minute duration and occur early in an illness like in otitis media, pharyngitis, adenitis, or UTI. Chances of later epilepsy is higher in complex seizures. So what is the criteria for febrile seizures? And the age of the patient should be between 3 months to 5 years. And there should be fever of 38.8 degree Celsius, and there should not be any central nervous system infection. If there is any suspicion of central nervous system infection, then it will never be called as febrile seizures. Clinical features of febrile seizures include they may present between 3 months to 5 years of age. There is mostly a predisposing cause is respiratory infection, and the seizure are usually brief, and they are bilateral tonic or clonic fits. They are simple when generalized, but with duration of less than 15 minutes and do not reoccur. Complex when focal and more than 30 minutes or multiple in 24 hours period. And what are common causes of febrile seizures? These are mostly viral. There may be upper respiratory tract infections. There may be acute otitis media, pharyngitis, adenitis, or urinary tract infections. These are common causes of febrile fits. What are the investigation you go for febrile seizures? You must take blood count of the patient. It will tells you about either there is an infection or not. You have to take LP, lumbar puncture if required. You have to take blood sugar levels, calcium, phosphorus, and electrolytes. As low blood sugar level, which is called hypoglycemia, is also a very common cause of febrile fits in pediatrics age group. Low calcium levels are also very common cause. Low phosphorus is also a common cause, and blood urea nitrogen if raised, they may also cause febrile fits. Or if there is any electrolyte imbalances like sodium or potassium or chloride, they may also present as fits. So you have to rule out these all causes of the fits before labeling any fit as a febrile fit. An EEG electroencephalograph, if febrile fit is complicated, you may require an EEG to identify the cause of seizure. What is the treatment? The aim of the treatment is to control the fits and to control the fever. If you control fever, then you will definitely the seizures will subside. Control fever with water sponging and paracetamol 10 mg per kg or 60 mg per kg per day. You may start antibiotic if there is any infection other than CNS infection. You may also start you should also start antibiotics in case of a CNS infection, but that may not be a febrile fit. You have to control seizures with diazepam 0.2 mg per kg, slow IV diluted, or you may use phenobarbital 3 to 5 mg per kg slow diluted in IV, or you may use paraldehyde 0.15 ml per kg per rectal diluted in mineral oil. So what is prophylactic antibiotic convalescent for febrile seizure? These are usually not indicated in case of uncomplicated febrile seizures, but if there is a complicated or prolonged febrile seizures, or if medical reassurance fails to relieve the anxiety of the patient's attendant, then you may use anticonvulsant therapy for febrile seizures. So prognosis is good for febrile seizures, but may present with psychomotor epilepsy, just only in 6% of cases. Thank you.